to DXBToday. Bit of a sort of medical special. Why? End of the year just around the corner. Resolutions are plenty. And what's that advice we always get? Always get a second opinion. Well, today we're getting about 4 opinions on the show, but they all seem to be tracking the same way. Let's get our next guest into the picture now. Consultant orthopedic surgeon at the Adam Vital Hospital, joining us now live here on the sofa, Dr. Kutaiba Salman. Thanks so much indeed for being with us.
Thank you very much for having me.
Kind of you. I think you know the question that's going to come first and foremost.
Yes.
Again, it is that start of a new year. I mean, is it... everyone has that, you know, we call it the resolution now, but it's that new chapter, it's new life, it's making a few amends. Is there anything wrong with that? Do you see an uptick in the number of appointments?
Yeah, sometimes we do, because some people has the knowledge enough that they want to plan something. We're talking about exercising, which is a part of many people who decide to start a new and healthy life will go through. But
does that come with risk? Because if people say, right, from January the 1st, I'm going to play tennis every single day of the week, and I'm going to turn my body around.
Exactly. And that's what makes it sometimes healthy but unsafe, because you have to be sure which sport you're choosing, because not all sports fits anybody. You know, you have to make sure that you're choosing something which fits you. And we're talking now about the ordinary people, not those who are bodybuilders or professional sport professionals. We're talking about the ordinary people. So you never know that you have, for instance, as simple as some defects in your joints, you know, and that's or your muscles. And it's not you who decide whether you're fit for this or not. Always a good idea to consult your doctor for further information about what you'd like to do, and as simple as that, you know. So you be safe, because I can give you an examples of somebody who is trying to go to the gym, and then they start pushing on them, the coaches and the trainers, they start pushing on them too hard, and they come with different sort of injuries.
Sure. That's what I was planning on doing to Dina when she starts her New Year's resolution.
So what would you advise? What kind of exercises would you advise to prevent?
Of course, before starting exercising, I would, like everything else, if you have a good foundation, I would recommend that you write everything down, make it as a plan, so that will become verified, and then you could always go back to it and check whether you're doing it or not.
Or getting a goal. Like having a goal.
Exactly.
Yeah,
as simple as, also very important is to check your vitamins, because you know we are privileged being living in Dubai, that you have the possibility that you just go directly and see your specialist, or even the subspecialist. I don't think this is available anywhere in the world at the moment. So just going there and, you know, trying to talk with your doctor and your specialist about what's your plans, that will be much safer and much easier for you.
So, Dr. Kutaiba, I've been giving away my age all episode. Okay. Turning 40 next month. Anyway, but I'm just taking a lot of things into consideration. One, injuries. Whenever I get injured now, you know, it used to take me a couple days to recover from, now lasts a month, and it can be something as simple as me like turning my neck. Like, I don't know what's happening. No. So what can we do to prevent injuries, to keep ourselves generally healthy, but also if we're someone someone like me who's not that as excited about working out in the gym, what other measures would you, or activities or whatever it is, healthy lifestyles to maintain, would you recommend? That wasn't really English, but you got it.
Yeah, there's no... many don't have even probably the time to go to the gym, you know, because of the family circumstances or because of the job circumstances. There are so many things you could do at home, as simple as, for instance, walking, you know, or going up and down the stairs, or even do some cleaning in the house. Just keep moving, you know. Again, as part of being in Dubai, most of the people have a gym nearby, but at the same time there is a swimming pools, and there is the hydrotherapy, which is a very safe and recommended kind of exercise, and so on, you know. some people are also fortunate that they have their rituals, especially for Muslims. Like we have these prayers 5 times a day, where you do all these movements and what you require to be fit. You do the squatting, you do the standing, the sitting. So it's all in this ritual.
A little bit like yoga. No.
Again, yeah, some people are also privileged that they can do and go deep inside with some kind of meditations and yoga and things like that. All these things, I would say, they are safe, safe to practice.
I think a good balance between your mental and mental health and physical. Thank you so much, Dr. Kutaiba. It's been a pleasure to have you here in the studio with us.